Yeah, he's everybody's favorite doctor. Dr. Joseph Akama is here with us. And he's got all you need to know about hypertension and other lifestyle-related diseases. And in a short while, we'll open up the phone lines because it's your questions that matter the most. And he will answer as many of them as he can. All right? So we'll open the lines in a bit. But first, Doc, how nice to see you.
Good to see you.
Indeed.
Good morning,
indeed.
and good morning to your viewers.
Yes. Now, you know, I always relish opportunities to talk about lifestyle diseases. Yeah. I have one. I'm diabetic. And I'm not the only one. In fact, the latest figures suggest that 1 in every 9 Ghanaians has already been diagnosed with diabetes. That's 11% of us. So in essence, these are the ones we know about. There are likely to be droves of Ghanaians who have lifestyle conditions that we don't know about.
Exactly.
But hypertension has for a long time been the #1. It's been the one that affects the most Ghanaians. And today, I think, in anticipation of World Hypertension Day, we should take the opportunity to equip Ghanaians with some knowledge. So I'll let you talk us through it. When people talk about hypertension, what does it mean? What's actually happening in the human body of a hypertensive person?
Yeah. Thank you very much, Kojo. With the situation we're dealing with is really staggering. The numbers are increasing. You know, the general population of Ghana is also going up. Yeah. So if you use 7%, 1 in 9 people, and you put the numbers down, you'll be amazed how many people are really affected by diabetes. But like you said, hypertension is the mother of all lifestyle diseases and is a mother of cardiovascular conditions. And that's the #1 reason why a lot of adults die in Ghana now. The last census from Ghana Health Service, their data suggests that hypertension is leading. Yeah. It causes strokes, causes heart attacks, causes heart failure, and is the leader of all killers in adults. So when you have hypertension, what it means is that the blood pressure within the vessels is so high that your body cannot contain it. Right. Like I always use a water hose as an example. So if you have a garden and you have a water hose and you point the water to the ground, assuming the water is flowing at a low pressure, the ground is smooth, the soil is happy, the water just runs down and nothing happens. But you increase that pressure and see what happens to the ground. It digs the dirt out. So similarly, that is how the blood pressure causes its effect within the body, literally. Right. And we need the pressure. So if you don't have pressure, you're going to have problems. Everybody needs some amount of pressure for the water, blood, to be carried from the heart to the brain, to the legs, to your liver. We need that pressure. But when the pressure is over and beyond 140 over 90, then we'll call it hypertension. So what are the issues? When that pressure goes up, the end organs, and we call end organs the organs that use the blood. So the brain is #1, the heart itself is #2, the kidneys, #3, the vessels that supply the blood are end organs too, the eye. So all of these are affected by the fact that the pressure is high within those vessels. It begins to denude the surface lining of the vessels. And when that happens, you can deposit stuff. You can have inflammation. So you have cholesterol deposition. And sometimes the vessel is so fragile that the pressure goes up suddenly, the vessel bursts open. And when that happens in the brain, it is a catastrophe. So over time, let's take the typical end organ, which we're always worried about, the heart, as an example. So initially, the heart tries to contain the situation by becoming macho, literally. So the muscles build up. So you get heart enlargement. But over time, it cannot contain it. And then suddenly, it becomes more dilated and weak. So the heart, which was probably about this size, will suddenly become that size and becomes ineffective in trying to carry the blood outside the body. To supply the rest of the body.
And that is what causes all kinds of heart problems.
Exactly, heart failure. And then the diminution, if you have destruction of the vessel lining, they have deposition of cholesterol. and we have these terms we call atherosclerosis. Atherosclerosis is basically cholesterol that is deposited, and you react to that cholesterol by forming things to contain it. And before long, you block the artery, you have less blood supply, and if that cholesterol breaks up, it causes a clot within the vessel, and then you shut down the blood supply. So two instances will be a heart attack, where the blood supply is shut off from the heart, or a stroke. So suddenly a cholesterol breaks off from the plaque and then stops the blood from going to your brain, and then the person collapses.
Wow.
Yes. So these are all effects of the blood pressure. Not to talk about other small organs. For instance, men, the biggest organ for men that we're always worried about in terms of our functionality is the penis. And that organ depends on blood supply. The mechanism for which it works depends on blood supply. So if the pressure is persistently high, that mechanism is destroyed. And for a patient or an individual with blood pressure for about 5 to 10 years, it won't function well. It won't function well.
So tell me, are there symptoms? I mean, are there things that a person might feel if they are suddenly developing hypertension?
Certainly, certainly. So blood pressure can be viewed as three forms. There is one that most of us have that we don't know. We go to a hospital and then they say, oh, your blood pressure is high. Really? I didn't know that. So that is, majority of people do not know that they have high blood pressure till it makes a sound or it cries out, meaning the body is reacting to that blood pressure. And then they present with the acute form. So the acute form is when the end organ is suffering from a very highly elevated blood pressure. So for instance, somebody can suddenly become confused because the brain is overwhelmed by a sudden surge in blood pressure, and the brain gets swollen, become confused, or sudden severe headache. That will mean a catastrophic stroke, bleed into the brain, and then, or they will just collapse.
Wow.
They don't say anything, they will just collapse.
No symptoms.
No symptoms. That is it. Wow. Maybe they bled into the brain. Another common one will be severe shortness of breath. Suddenly, he went to a meeting, maybe a heated argument, or a very stressful meeting, then suddenly he holds his chest, he's having shortness of breath, they check the blood pressure is very high. That's another form. And then in between this dramatic, severe presentation, where they present with either stroke or heart attack or shortness of breath, there is that group of people whose blood pressure is so high, but they're damaging their organs slowly. And in the next 5 to 10 years, they present with a chronic presentation of hypertension. The commonest one will be kidney failure. So the kidney failure can happen suddenly or over a period of time. So you're not aware that your kidney is being destroyed by the blood pressure. Then you go to hospital, your urine output is not as much as it used to be. You're wondering why you're not urinating as much. Then you go to a doctor's place and they say, nope, your kidneys are shutting down. And that is the chronic type of high blood pressure, where it just damages the organs slowly. So people can have symptoms, but majority of people do not know that they have high blood pressure.
Now, can other lifestyle diseases lead to hypertension, like diabetes and so forth? Can they?
They are interrelated. There is no direct link between diabetes and hypertension, but the two of them in one person is a disaster. So they combine to cause problems to the person. But diabetes cannot cause hypertension, and hypertension cannot cause diabetes. But the factors that lead to diabetes are similar to the factors that lead to hypertension. So in a way, they have the same origin, but they don't interrelate. But when they cohabit, or they're existing in one person, that's a disaster, potential disaster, in that the own organs are damaged quicker and more severely. Yes.
Now, so for people who have hypertension,
yes,
if it is possible for you to have it without even noticing, then what do doctors recommend? How do people make sure that they don't yeah, fall victim.
Yes. So to begin with, what I would tell my fellow Ghanaians is that as a Ghanaian, we are all at risk. We are all at risk of having high blood pressure. Why do I say so? As a black man, as a black woman, that is our #1 enemy in terms of lifestyle diseases. So tomorrow will be World Hypertension Day, and the emphasis is that we should know our numbers. We should know, as an individual, you need to know your weight, your regular weight, your sugar level, your blood pressure, your cholesterol level, your kidney function intermittently. And especially if you have a family that have hypertension or kidney disease or diabetes, then you have to be checked more frequently. If your mother had hypertension or your father has hypertension, the likelihood is that you're also going to have hypertension. But there's no direct correlation that my father will give me his hypertension or my mother will give me his hypertension, but her hypertension. But the fact that they have it increases my risk. So I have to take action. So first, check your blood pressure regularly. See your doctor. If you don't have a doctor, Ministry of Health is trying to get Ghanaians to the notion that we all have to have a doctor, whether we're healthy or we're sick. Everybody has to have a doctor, and they call them primary care providers. So you see a doctor regularly, even just for a check. Go and say, hi, I have my National Health Insurance card. I'm just coming for a routine check. Tell me what my numbers are. And they are obliged to inform you what they are. And once you know that, once the BP begins to go up, you will know. And that is the only way you can detect that you are getting hypertension.
Indeed. So regular checks as often as you can. Now, when you were describing some of the symptoms, you talked about how perhaps you've been at a meeting, you've had a heated, discussion, and suddenly you feel pains in your chest. So I'm getting from that, one of the common things people know about hypertension is that your stress levels can affect your blood pressure. So does that mean that there are things we can do to lower our blood pressure? Can you talk us through some of the things that we can do without medication, perhaps, to control our blood pressure?
So just like other lifestyle diseases, so hypertension, diabetes, cholesterol, these depend on risk factors. In Ghana, we notice that one of the risk factors we don't talk a lot about is stress. Stress is a common risk factor that permeates all the lifestyle diseases. Another one is inactivity. Inactivity in terms of not exercising regularly. We drive a lot. We don't even ride bicycles these days, a lot of Okada motorbikes. So we don't do a lot of exercise. And then you have the diet, our diet. So if you're able to attack these, your stress level, meaning do you take vacations? Do you relax? Do you take breaks? Are you doing so many things at the same time? Which a lot of Ghanaians do. We are multitaskers. And when we are doing multiple things, one, we fail to conclude on particular tasks before going to the next one. So we have a lot of pressure on us, and the stress level goes up. So stress can be relieved if you can take one thing at a time, if you can take time off to rest, and if you can stagger your activities. Maybe put them at later days. You don't have to attack all of them at the same time. So that's one way. Another way is to decrease our dietary sodium, meaning how much salt do we eat? How much salt do we eat? So particularly hypertension is related to salt intake. So most of our Ghanaian dishes are full of salt. Another one would be alcohol. Alcohol consumption in young folks leads to hypertension. Whether it is a beer or any spirit, whether it is small quantity but regular or a large volume of beer, you are predisposing yourself to hypertension. And then we talked about the lack of exercise. So if you're not exercising regularly, and myself, my wife will probably be saying, look at who is talking. I have to exercise. We have to exercise. As a cardiologist, I encourage my patients to do it, but do I have the time to do it? Sometimes we complain, but I have to make time and exercise. And you don't have to join a gym. Just hit the road, okay? go to a school with a football park, walk there 3 times, 4 times every day. And the recommendation currently is that if you walk about 30 minutes per day, get your heart rate up to about 120 above, you're okay. And if you do about 1 hour a day and keep your heart rate really high, you're going to lose weight. You're going to gain the cardiovascular benefit, which is protective and decreases your cholesterol, decreases your sugar, and then increases your vigor. So those who are interested in sex lives, exercise improves their sex lives. Yes.
Well, there's the best motivation I've heard for going to the gym yet. Okay, so let's see if we can bring in some of your thoughts and your questions. Give us a call, 0302-211-691 or 692. 0302-211-691 or 692. Dr. Akama is ready to take all of your questions. He will knock them all out of the park, no doubt. Now, Doc, you know, in the past, lifestyle diseases used to be considered the preserve of the rich.
Yes.
You know, but now we're hearing about so many people contracting them, particularly young people. I mean, tell me, what are the factors that are behind so many young people getting strokes and you know, other cardiovascular conditions? Is it all because of hypertension?
Yes, so hypertension, like we said, hypertension is a matter of all the lifestyle disease, in my opinion. And the reason why we're realizing that the hypertension is becoming a problem in this country is, one, we're checking a lot of people.
Yeah.
Two, there are a lot of hospitals with BP apparatuses, and then we have dropped the criteria. So at first, we used to have a very high criteria for hypertension, 160/95. Now the criteria is dropped to 140/90, and some countries like US even drops 135. So anything about 130, you are hypertensive.
Interesting.
So with that number going down, we capture a lot of people. That's one factor. But the most alarming factor is our lifestyle, our dietary changes, and then our ability to adapt to stress has suddenly changed.
Right.
At first, we had a simple life. You had your family, you had your neighbors who were co-helping manage your children. Now, we are living a solitary life, literally. So you have a community that does not even know who is who. So there's no that we've lost that communal togetherness, the social aspect of a Ghanaian society. So individuals have become solo in their fight for survival. And when you do that, you're fighting a lot of things. You have a lot of stress coming in, and then you have to eat fast food, which is full of sodium. And then you have sleepless nights because you are attending school. You have to go between jobs. So all of these are making predisposing all the young people to high blood pressure.
Doc, I want us to take a few calls. Kennedy Adomako is calling us from Kaswa. Kennedy, how nice to hear from you. Good morning. What's your question for the doctor?
Yeah, good morning. It's not actually a question, but I just want to contribute to the program. I'm very interested in the topic. So I'm enjoying it this early morning.
Oh, okay.
Yeah, my contribution is like this lifestyle disease has become rampant in our country. It's because of the junk food, which is so much in the country. Our food is only made up of a lot of oil, which is the oil in the market are most of the hydrogenated. If Dr. Ankama will bear with me, we eat more, we don't exercise. Right now, from your car, you go to your office, you sit, especially people that work in office, have a high rate of getting hypertension and this kind of lifestyle disease. Because you people don't exercise a lot. And it's affecting us. We, the youth, are coming. We need you people. You need your advice. You need people like you to be teaching us. Could you imagine that our fathers, our great-grandfathers, could live for a very long time? Have you ever asked yourself why so? Because they work a very long mile to the farm. When they go to the farm, they'll be working. At the same time, they'll be eating. So they'll be burning all these calories. But we don't do it. You go to someone, talk to someone about health. The person thinks like you are even punishing him or her about it. But doctor, thank you very much for bringing this program up, and I'd love to encourage you or tell that maybe if you can even have some organization, you'll be going out to tell people about this kind of things they can change away from. And our cookware too is not helping us, doctor, if you can bear with me. Because when we cook, all the free radicals leaches into our cookware, and it changes the taste. We end up putting salt and Maggi to compensate the taste, and all are killing us. So if we can even talk to the minister to do something about this aluminium and other cookware, which is killing us in the country, Doc, I'll very appreciate it and be glad about it.
Yeah, wow, thank you. Thank you so much, Kennedy. I'm so glad you called. Very thoughtful there. Okay, let's take some more calls. Isaac Owusu is in Seshi. Isaac, good morning. How are you?
Good morning. I'm good. How are you too?
Not bad at all. Thanks for calling us. What's on your mind?
Yes. I just want to be educated as we are now. You know, just as the first caller said. Nowadays, all that we do, everything we do, is leading to this cardiovascular disease, this hypertension, all that. In fact, the doctor made mention of this kidney problem. There is one disease that, you know, most of these youths nowadays are contracting, and it is due to our lifestyle. I want to know, with that of the kidney issue, can you go to any hospital and then ask that you want to be tested, you want to check your kidney functions and all that? And then my second issue is about smoking. You said smoking is also a contributing factor. You know, the youth nowadays are not into this cigarettes that has this picture of cancer and this taking pictures on a pack. But then they are now mostly into, if I may say, weed, that is Indian hemp. And when you visit them, what they tell you is that these cigarettes are not good, they cause cancer, they destroy your kidney. Oh, but man, this weed, this Indian hemp, it is good, that it has no side effects. I want to know, apart from how to check your kidney status, is it true that Indian hemp is a different class of weed that does not affect us when
Right. Okay, so your question is, does smoking weed, does it also contribute to hypertension? We'll get you an answer in a moment. Let's take a couple more calls. All right, Philemon Ayete is in Hohoi. Philemon, good morning to you. What's your question for the doctor?
Okay, good morning.
Yes, good morning, Philemon. Go ahead.
Okay. Actually, I just want to thank Doctor for the lovely program this morning. Yeah.
Okay.
I just want to thank Doctor for the lovely program this morning, because all he's saying, I have those symptoms, but since when I go to the hospital, they don't normally detect this and tell me.
Oh, okay. So you feel like you have some of the symptoms that the doctor is describing.
Yeah,
perhaps
I actually have them. But when I do visit the hospital, they don't normally tell me anything concerning that.
perhaps you should try another hospital. It's very important that you get a medical opinion on this, and you get thoroughly checked and tests are done to make sure that you're okay. So please, I would advise that you visit another hospital and insist on some tests and see what they come out with. It might be that you're actually fine. Your symptoms might be down due to other things, but it's important to check. Right. We'll go to Kweku Man in Bibieni now. Kweku, good morning.
Good morning, sir. How are you?
I'm very well, Kweku. What's on your mind?
I wanted to ask the doctor whether children have any predisposition to hypertension.
Okay. Good question. Thank you for that. Let's take some answers and then we'll get a few more calls. Doc, a few things there.
Yeah, thank you very much for your questions. Very interesting viewers, and they are challenging. So let's talk about the gentleman from Sefi, Isaac, who wanted to find out how to check for your kidney function.
Yeah.
There is a blood test, simple blood test called kidney function test, okay, that you can request for. Also, you need to check your urine analysis. So your routine urine analysis, because the kidneys produce the urine. So if there's something wrong with the kidney, it will show in the urine. For instance, protein, a common thing that should not show in the urine. Once you start having protein in the urine, there's a problem with your kidney. So if you go to the doctor, tell them you don't want to check your kidney function, they shouldn't argue with you because it is your right. Don't let any doctor bamboozle you. Tell them, today I'm just coming to check every organ of my system. So long as you have the money to pay for the labs.
Yes.
Because some of these things are expensive. And you're not doing them frequently. You're doing it once a while. So you have that right. In terms of smoking, fortunately in Ghana, we don't have a lot of smokers and smoking cigarettes, 7%. But in the villages, like you mentioned, there's a lot of smoking going on there. Tobacco, Indian hemp, and other things. Now, anytime you smoke something, whether it is a chemical or any weed, there are components that get into your system. So for tobacco, is the nicotine that stimulates people that they get addicted to. For Indian hemp, similarly, there are chemicals in there. The cannabis produces a chemical that makes them feel good. But it also comes with a trade-off.
Yeah.
You are dirtying your airways. So anytime you smoke, it's like having exhaust getting into your lungs, filling up the airways, making it not able to filter the oxygen. And the airways are supposed to filter oxygen. So now you can imagine lining up that airway with soot. So you have soot lining up your airways. Over time, you're going to have something we call COPD. That is chronic obstructive pulmonary disease, where you cannot breathe. It's almost like bad asthma, where you have to be on oxygen for life. And that is really, really bad. So Indian hemp has some medicinal purposes, but don't let them fool you to say that, oh, it has nothing to do with your lungs and is very good. The areas where they allow are for medically indicated instances. So there are some conditions where Indian hemp may help. For instance, somebody with cancer who is not eating, chronically ill, smoking Indian hemp might help that person. But for a general population who are happy and going, do not engage in Indian hemp smoking because the bad effects we're yet to understand. And some people get crazy from just smoking one joint. So there are other effects of Indian hemp that we don't know. Now, to the caller from Hohoi, you answered him, and I think there are symptoms that can go for different disease pattern. It doesn't necessarily mean you have high blood pressure or cardiovascular disease. Like you said, go see another doctor, have patience, go at a time when the doctor is not very busy. Sometimes we don't understand our primary care physicians. We go and they're not patient. They're not patient because they're overwhelmed. So you can imagine you're the only doctor in a district hospital seeing 60 people. And you come in to have a chronic condition that he has to explain. Sometimes he doesn't have time. But go get him at a time when he can have time with you, explain to you. With Kweku from Bibiani, the problem in Ghana is obesity in young children and hypertension in young children. So we have 15-year-olds with high blood pressure because we, the parents, made them so. Nobody else. We, the parents, gave them the ability not to walk, not to exercise, not to play outside, not to eat the right food. We give them fast food. I don't want to name them, but you know those I'm talking about. And those are leading to childhood obesity, which is staggering in Ghana. And then childhood obesity is #1 predisposition for hypertension. There's a colleague of mine in Kolebu, Kweku. He's studying children and hypertension, and the numbers he's getting is alarming. So it is currently not the same predisposition like adults where age, the stress, and other things. Children is mainly lifestyle, the food we give them, the obesity. So Obolo children at a very high risk of high blood pressure.
Wow, that's important to know. And like you said, if you have an overweight child, then we did it.
The adults. We did it
to our children. So very important for us to keep them healthy and active. Now, I have a question, and it's about whether or not the drugs for treating hypertension are free on the NHIS.
Yes, so indeed. So the National Health Insurance has been emphatic So there's the Ministry of Health has the essential drug list, and all hypertensive medications are on it. Of course, if you're looking for high-level proprietary names, trade names, they are not on the National Health Insurance, because one drug can be somebody's salary per month. But the common ones,
the
generic ones are all on the National Health Insurance card. So the main thing is to make sure your National Health Insurance card is not outdated.
Right.
Once you have it, you can go to any of the Ghana Health Service posts, or you go to teaching hospitals. Of course, the teaching hospitals are overwhelmed. But when they come, we give them medications, we fill the forms, and they'll go and get 90-day supply, 60-day supply, all on their cards.
Wonderful.
Yes.
All right. Akwesi Adomako is in Malam. Akwesi, good morning. Thanks for calling. Your question?
Good morning. I have a question for Dr. Ankama.
Okay.
Yeah, he said we should reduce the salt intake. And my question is, you know, this our cookware doesn't support. If it doesn't put in the salt, you're not going to feel the taste. So how am I going to do it? Since you know that if you cook and there's no salt in, salt compensates the taste. Salt helps us to hear the taste. So since the doctor is saying we should reduce the salt intake, how am I going to do it with my cookware who doesn't, even if it doesn't put in small salt, you're not going to have the taste of the food? What should I do about it?
So yes, the main reason why we like salt is because it's salt. Okay, we love salt because we're attracted to salt, and we think, have you seen a sheep chasing after salt? They love salt, and human beings also are attracted to salt because of the taste. We like sweet things. Our tongue is made for that. But what we don't know is that that salt you're eating or consuming is affecting you. So yes, the food doesn't taste. You have to have an acquired taste. It's almost like when you travel to a white man's land. Most people cannot eat their food for years. There's a man who was there for 10 years. He couldn't even adapt to their food because he has to acquire the taste. So we have to have an acquired taste. So you don't just cut off the salt immediately. You start decreasing it till the point where you actually taste the natural taste of the food. For instance, you can use things that will give you some taste. So if you're cooking stew, instead of putting a lot of salt, you could add a lot of cabbage, okay, with sweet peppers. These with onions. You know, onion has a taste.
Yeah.
So if you combine these, you'll be able, now I'm making myself hungry. So if you combine these, you come out with a good meal with little salt, but you can taste it. Wonderful. That's the essence. It's not completely cut it off. And believe me, if you talk to people who have stopped eating salt, they do not want salty food. They cannot stand salty food because gradually they've been able to win themselves off.
Trust me, so, I know this for a fact. When I first got diabetes, it also presented with kidney failure. So I was put off potassium and all kinds of things, and I had to stop eating salt and plenty of other things. And I got used to it. Now if you put salt in my food, it tastes a bit too sharp.
And look at you. Yes. Looking smart. Alive. Yes.
Yes, if I have a choice between feeling the taste, as our caller said, and feeling alive, I'd rather feel alive.
Yes.
Right, Rashida Abdullah is in Ejira. This is our first lady caller. Rashida, how are you? Good morning.
Good morning.
Talk to us. What's on your mind?
Kojo, I just want to say thank you to you and the doctor for this program.
You're very welcome, Rashida. You're very welcome.
Yeah, because I lost my mom's hypertension 2 years ago. And so I just want to say thank you very much for educating the public on this condition. Yeah, thank you very much.
Oh, well, we're sorry for your loss. What a pity. Yeah. But yes, I hope at least the education brings something good out of a tragedy. Yeah. Christopher Agana is in Kwabing. Christopher, how are you this morning?
Yeah, I'm good. Good morning.
Good morning to you. Thank you for waiting. What's on your mind?
Yeah, this is good education. I just want to commend Doctor for the education this morning. But then, as Doctor indicated in his education, he didn't mention of dizziness as part of the symptoms of hypertension. I want to find out if dizziness.
Dizziness.
Because I have a close friend who complains of dizziness, frequent dizziness. It comes, he has hypertension, and the attack comes in the form of dizziness. So I want to find out whether it's bad and what can be done to avert that dizziness that the person is facing.
Great question, Christopher. Okay, Doc, I'll add one question of my own, so you have two to answer. These new diets that have come up, one is called the keto diet. Lots of Ghanaians very excited about this diet, which, I mean, just when I hear the word keto, I immediately think of kidneys, and I'm wondering whether it's having some effect on kidney function. Is it? Are these diets also dangerous for the possibility of contracting hypertension?
Well, so let me go to Chris at Kwabenya's question about the dizziness. So dizziness is one of the symptoms where every doctor would like to help but really doesn't want to hear about because there are so many reasons why somebody can be dizzy. As he rightly said, high blood pressure can cause dizziness. Low blood pressure can cause dizziness. Nerve issues can cause dizziness. Heart rhythm can cause dizziness. So sometimes it's really difficult to deal with. But the reason why high blood pressure will cause dizziness is because it's affecting the brain. So the brain controls our balance center, our sense of positioning. So if the blood pressure is very high, it is a warning. If the person begins to have dizziness, it's a warning that if he doesn't take care, he might get a stroke.
Right.
So anytime you have dizzy spells, you feel dizzy, it's good to go get checked. Even ear infection can cause dizziness. So yes, high blood pressure can cause dizziness. And the reason is that the pressure within the brain is so high, it affects the balance center, it affects certain movement issues within the brain that is translated to the person feeling dizzy. And when the blood pressure comes down, they feel better. So it's always good to check when you have dizziness. Regarding the diet, I have said this several times, and I'll say it again. Eat what your mother gave you in moderation. That is my new teaching. Eat what your mother gave you in moderation. The reason is we are going to hear about keto diet, high protein diet, high calorie diet, do not eat this, do not eat that. And it's a wash, okay? It's a wash. There are people who are proposing these things and pushing it on people. If you do it within a short period, you get some benefit. The keto diet is to stimulate your body to start using the fat, burn the fat, so you can lose the fat deposition. So basically, obesity is because we're storing for a lean season. That is the basic thing. So body, anytime you eat fufu, your body uses maybe 20% and then throws out 50%. Then the 30% is stores, okay? So it stores for a lean season. But will you ever get a lean season? No, because the following day you're going to eat another bowl of fufu.
That's right.
The next day, banku with rice and all. So you're just storing without using it. That's why you need to burn the fat. But if you eat the fufu in moderation, then you don't have a whole lot to store, and you burn it. So what I think our forefathers used to do, and I'm a Frafra man, they eat early morning, lunch, evening, sometimes they don't eat anything, or lunch they don't eat anything, okay? By the time they come home from the farm, there's nothing to do. They just go and sleep. But what do we do these days? We get up in the morning, we drink a small cup of tea, maybe with loaf, bread, or, and then we get eggs. Then we eat a hefty lunch. Then a very hefty dinner. Then we go and sleep. So you're not burning that calorie. So late eating, if you can reverse it and rather do heavy morning, heavy afternoon, and nothing in the evening or little in the evening, it will help.
Wow.
Rather than
some of these newfangled diets.
And stuff.
Okay.
Yes.
Well, there you go then. Let's talk to Bright Wonder in Sunyani. Bright, good morning. Thanks for calling. Good. So what's your question?
Good morning, sir.
Good morning. Is that Bright?
Yes, please. This is Sir, I want to thank you so much, particularly to Mr. Dr. Ankama for his. Yes, please, this is Bright.
Bright, please stop listening to the TV. Just listen to your phone, okay? The TV has a delay, so don't listen to the TV. Just listen to me on your phone. Switch off the TV or put it on silent, and let's talk on the phone. Go ahead. You were talking about Dr. Akama.
Yes, I want to thank him so much because this particular disease killed an uncle of mine last 2 years ago.
Oh.
And it got me thinking about how the disease actually works. So, please, I would like to suggest that more of this education be given to us, not only about this hypertension, but other aspects of health so that we know how to manage our life. Thank you so much.
Thank you so much. Thank you. Right, let's speak to Joseph Kancha in Bolga. Joseph, good morning to you.
Yeah, good morning.
Wonderful to hear from you. What's your question?
Yes, I say good morning to Doc. I say Blika. Yeah, I think with not listening to politics this morning, I can feel some level of, I'm not heavy. I feel some, I don't know how to describe it, but there's some kind of feeling within me, I don't know. Doc, I think I appreciate the education. As he said, one time I walked to a clinic. I had that feeling that I have a problem within me. I asked for kidney and then liver test. But after the test, the doctor told me that I have that my protein is 19% high. And also that the kidney, the salt level is a little bit low. So when I heard doctor say we shouldn't eat salt, I was like, but they are telling me my sodium level is low. And here's the case, I'm not supposed to eat salt. I don't know how to balance it. And also with the protein, that protein level, I was advised to stay away from seafood and then meat and then maybe some fruits. With the meat, I was like, okay. The fish, I was a little bit doubtful. And the fruits, I was like, we are advised to eat fruit. And now I'm told not to eat those things. I was a little bit confused. But I was given some drugs, but I wasn't okay. I wanted a natural way of getting rid of this protein. So I don't know if doctor can help me in a way, and especially the salt. That is what we shouldn't take.
Very good. Okay. Doc?
Yes. So you're right. You know, this advice I gave was for people who have high blood pressure, people, general population who want to have a healthy life. But dietary advice also can go with certain types of conditions. For instance, if you're diabetic, we'll tell you not to eat too much sugar, no honey and stuff like that. If you have a kidney problem, we'll tell you to avoid certain foods because you don't want to overload the kidney and cause problems.
Yeah.
So the first thing is always to find out, why do you have the low sodium? Okay. So if you have low sodium, there must be a reason. Either you're not taking enough, or you are drinking too much water, which can dilute your sodium. Okay. Or there's a kidney problem that you lose the sodium. So it's not just a straightforward answer whether you should eat salt or not eat salt. And sometimes having low sodium, we might not even have to give you salt. We just have to stop you from drinking a lot of water.
Right.
And then your sodium will build up. So, and besides, you also have to be careful with which lab gave you the results. Because these days, we have labs that give us results that we can't understand. So anytime there's a problem with your lab, it will be good to go to another lab and cross-check. Just like if a doctor tells you something, go to another doctor and get a second opinion. So if the lab tells you your sodium is low, this is this, go to another lab unless the doctor says, I trust this lab. And even with that, there's no problem you going for a second opinion. So people with low sodium, obviously, if it's significant, will allow you to take some sodium. Okay, that's salt. But we need to know why.
Very good. So that means you need a conversation with your doctor, Joseph. Let's hope you get some more education there on your situation. Ibrahim Tabiri is in Brekum. Let's hear from him. Take maybe 2 more calls and get some answers. Ibrahim, Good morning. Thanks for calling us.
Good morning.
So your question this morning? Ibrahim, I want you to listen to us on the phone. Don't listen to the TV.
To you from the phone.
That's right. Go ahead. What's your question?
I have a personal problem, and it's about my headache. Severe headache. And the headache is around half the size of my head. It pains so much so that it's very difficult to even stay. And it got to a time I went to hospital. I've been to hospital about 4 or 5 times. Different hospitals. I was diagnosed. I was told, I went to lab and I was told that I have sinuses or something. They mentioned something like that. But the symptoms that the doctor mentioned, it's like I'm having some of them. But still, anytime I go to hospital, I ask of my blood pressure and they said it's normal, it's okay. But I could see I'm also putting on weight. At times I don't eat at all in the evening. Most of the time, I eat in the morning. That will be the end. I won't eat again. But still, I'm putting on weight. And this headache, the drug that they gave to me, when I start taking the drug, it goes off. The pain goes off. But the moment I finish the drug, about 3 days time, it starts coming again. I don't know what is the cause.
Okay, we'll get you an answer from the doctor. Let's speak to Yvette Yvette Enin in Takrady. Yvette, good morning.
Good morning, Kojo. How are you?
I'm very well. Thank you for calling us. So, what's your question?
My question is that I usually have a pregnancy-induced BP.
Okay.
And then what amazes me is that when I'm pregnant, the BP is normal, but it is usually when I put to bed that the BP goes high, and it comes with this severe headache from the left side of my head. Fortunately, I have the sign. If it is going high, I get to know through my heartbeat, and then at the left side of my head. And I keep on taking mifedipine. I don't know when it is going because I had it through childbirth, and then I just put to bed. During the pregnancy, it didn't come, but when I give birth, it comes. So I don't know. I'm just worried. It worries me a lot.
Okay, we'll get you an answer. We'll get you an answer. Thank you so much for calling us, Yvette. Doc, 2 good questions there.
Okay, so Ibrahim, I'm sorry about your headache. But you know, headache is one of the common symptoms that has multiple reasons. Especially in his case, it's becoming worrisome. It's affecting his lifestyle. It's affecting his whole being. So it becomes a significant headache. One-sided headache could be the sinus, like they said, but the way you're describing it, to me, it sounds more like migraine. Migraine or pressure-related headache or tension headache. So these are different types of headaches. Headaches could be as a result of something within the brain, pressure going up, or it could be because of the vessels getting to spasm. I would think now that you are done with your local doctor and you're not getting answers, it's time to move to the next level. Request a referral to see a specialist. And the people who deal with headache commonly are the neurologists. We have very good neurologists who can take you through the 9 yards, checking to see what type of headache you have. And if it's migraine, there's treatment for it. Another reason that we have to always think about is stress-related headache and depression. A lot of us have depression, but we don't really know it. And we have this aching, agonizing headache that we can't think, we can't do, we're crippled, we start gaining weight, we cannot sleep. So all of these have to be dealt with a specialist. And you could see a psychiatrist or begin with a neurologist. And once the neurologist is able to diagnose you, he can give you medications for it. So don't get discouraged that your blood pressure is normal and yet you're having headache. Well, there are a lot of other causes of headache. And sometimes they may need to scan your brain to determine what is going on. Yes.
Wow.
Yes. So So go try and see the neurologist. Tell them to refer you to see a neurologist, okay? Yvette, it looks like you're having something related to pregnancy. It's a pregnancy-induced hypertension, which we have different types. And the one you're describing to me sounds like preeclampsia, where the BP goes up after the 20th week in pregnancy, or even immediately after delivery. Sometimes it can go up with headache and other things. What it means is that after a period of time, the BP can come down. Whatever it is, I think nifedipine is a very good medication. It doesn't cause problem with your baby. It's a very effective medication for pregnancy-related hypertension. But more importantly, talk to your obstetrician, and he may have to refer you to a cardiologist to do other tests to find out, are there other problems related to this hypertension? But you work with your obstetrician, don't get frustrated, take the medicines, decrease your salt intake, try to relax a little bit. Talk about relaxing in a mother, isn't it? With a baby, it's difficult. But talk to your husband. He needs to be on duty. Husband of Yvette, you have to be on duty. Let her sleep sometimes. So you're on duty Monday night, Yvette goes to sleep. So you can take care of the children. And then Yvette can relax a little bit. That is very, very important.
Absolutely. Yes. Doc, that was so useful, so helpful. Thank you so much. Dr. Akama, of course, is with Kolebu Teaching Hospital. We appreciate your time.
Thank you.
Once more. Right. Okay. So get ready for the Joy Business Health and Wellness Trade Show. It's from May 30 until the 1st of June. It's at the National Theatre. And we're going to be discussing this issue and so many others over there. Stay with us. So much more coming up. I must apologize. We advertised that today we would have Wendy Shea on the show. We had a phone call from her management that she was rushed to the hospital. We're hoping she's okay, but unfortunately she won't be able to appear on the show. Also, we are still expecting ACP Kwesi Ofori. He is the director in charge of the Greater Accra Regional Operations, and we want to talk about safety and security in Ghana. So he is on his way. He's been called to Jubilee House, but he says that he will still come here after that meeting. So we're waiting. But in the meantime, though, look, let's talk about it. Let's talk about this big event coming up, the Health and Wellness Fair organized by Joy Business. Let's learn a little bit more about this trade show.
Access and availability to healthcare, as well as costs, are driving many to look for alternative ways of staying healthy and ensuring well-being. Learn more and participate at the Joy Business Health and Wellness Trade Show, which will focus on the general healthcare, pharmaceutical, herbal and treatment, with exhibitors and businesses from these industries. There will also be activities for direct consumer engagement and specialized discussions for corporate wellness, general well-being, debilitating health issues and concerns. It's happening from the 30th of May to 1st June 2019. Venue is the National Theatre here in Accra. The general theme is Good Health, a driver for sustainable development. Interested businesses should call 0544 310864 or 0540 106466. The Joy Business Health and Wellness Trade Show has been endorsed by the Ministry of Health and is supported by New Crystal Health Services Limited, growing together in good health, and Health Link Healthy Man and Woman from Pharma Trust Limited.